slash we could just group it as spinal injury in sports is not great. Actually, last night I was sitting there like, I don't like this data. It's still kind of old. I want to give you something newer. The newest systematic review I found last night is really kind of depressing when it comes to adolescent spinal injury. We really just don't know the stats. So make sure I get these going right. Everybody loves learning objectives. If you need those for continuing ed, it's there. So is anybody in the room going to become a sports coach of some kind or another? Hopefully, yes. Some of you possibly. All right, is the sport you're interested in on this page?
Yes.
Okay. So the funny thing about lumbar spine injury in athletics, lumbar spine injury in terms of preteen, adolescent, even collegiate level is very sad, because all of those sports I would consider somewhat collision / impact related injury types or overtraining types because of being in the weight room pre-competition or post-competition. The interesting thing about this is the highest incidence of go big or go home injury, which in youth sports is going to be a fracture versus just a muscle sprain in the lumbar spine, is cheerleading and weightlifting and gymnastics. So the ones that are not listed on the wonderful page of sports, okay? So why do I throw up a bunch of stats about old people? We don't care anything about what happens to athletes when they become adults, right? We're old wounded warriors now, right? So the funny thing is there's a new National Institute of Health article that's just come out on this stat, but they haven't published the data yet. So this one's a little old, the very top stat, but it ranks in the top 10 for the number of people who are going to see a primary care physician for back pain. The scary thing about that is obviously at some point in time in your life, if you live on planet Earth, you are going to have some form of back pain. The interesting thing about that is if you hurt your back or have some form of back pain at or before the age of 14, you are 5 times more likely to experience back pain that's recurrent after the age of 21. So is there a reason we need to address this? Is it in the literature to support it now? Probably not, but these people did something when they were kids. They did something to hurt their back or irritate their back. The big thing that companies look at in most insurance-related, we need to fix this in the literature, comes from how many work days they miss in a year. You're costing me money. You're costing me paying you for time off or a work-related injury. So you can see that's a pretty staggering number there too. And then the last stat is the most depressing stat because, as somebody just said back in the back, I'm tired of sitting all day. I don't know if you guys, kind of glance at that. We sit on average in the United States between 7.7 to 13 hours a day. So there's a whole lot of negative things that can come from that. So your youth athlete is going to sit in class all day long. If you're lucky, you might get their first hour as their athletic hour, or it may be their last hour that's their athletic hour, and this is going to predispose them to injury right off the bat, okay? So we have this poster in our clinic. It's just kind of funny thinking about the new modern day age in terms of spinal pain. So the funny thing about this is if you think this is still BS, if you guys want to try a little science experiment, again, I know you're not necessarily looking into PT, but every athlete needs to function and we need to make them perform at their best. If you all slouch like this, and try and raise your arm up, see how high your shoulder goes up in the air. So if you put yourself in a kyphotic posture or slouch posture, you automatically lose 20 to 30 degrees of shoulder range of motion purely right off the top. So if you can change an athlete's posture who may be a high-end thrower or overhead athlete or racket swinger, imagine how much better they're going to be just from simply fixing one goofy little thing that you didn't pay attention to. All right. So when we talk about training an athlete, in my personal opinion, unless you know basic planes of movement of the body, you know skeletal anatomy, and you know muscle function, you're probably not going to be highly effective as a coach or as a personal trainer. That's just my personal opinion, and it seems to ring through because you're a musculoskeletal expert at this point in time. So if you don't remember these or you've never heard of these, flexion of the spine basically means this. On average in the United States, a normal person is going to bend forward between 3,000 to 5,000 times purely based on everyday life, not including that 7.7 to 13 hours that we sit, which is the same thing as bending forward. Extension is arching backwards like this. Side bending is going to be going to the side like this. Rotation is this. And then combined movements are typically where we're going to get that go big or go home injury of some type of pathological fracture in the spine. So the combined movement, if you want to cause a preteen or a collegiate level athlete who has a little bit of a back stiffness when you're doing your 5 a.m. conditioning drills, which is what we had to do in college and football. All the fat guys had speed school at 5 a.m. The first 2 hours in the morning when you wake up is the point in time when you're going to be most vulnerable to injure a disc in your back. And to injure that disc, it's going to be, I think I have a picture, flexion and rotation. So if you get your athletes in this position, where are we going to teach most of our athletes to be whenever we're playing? In some kind of a ready stance, right? It's going to be flexion. And then if you have them doing a bunch of rotation or forceful movement with flexion and rotation, that's going to put the most amount of pressure on a disc that you can possibly cause. The pelvis, you can't really talk about core training without mentioning the fact that you have pelvic bones / hip bones, because every core muscle is going to attach either to what we call the axial skeleton, which is going to be the spine, the rib cage, or the pelvis, which are the two big hip bones that make the big ring or the center of mass for your legs. Okay? If you happen to be in anatomy or you're going into anatomy the next few semesters, if you're still in school, the old breakfast, lunch, and dinner approach will help you remember the number of vertebrae in the body. So you've got 7 cervical, 12 thoracic, and 5 lumbar. The question mark by lumbar is because you can have weird phenomenon where people's vertebrae won't fuse correctly, and they could have 6 lumbar vertebrae or 5 lumbar vertebrae that have fused to the sacrum, and now you only have 4. So coming back to this fun disc, there's 2 different parts to a disc when we talk about anatomy. And again, I'm just sharing this with you because when I was in school, nobody taught me this. I didn't get this until I got farther into my master's degree in terms of in-depth looking at the actual mechanics. So when we think about a disc, the funny thing is that for a about 16-year-old in the literature, it will tell us that they're not likely to injure a disc. It's just not going to happen, okay? This is going to be that more of the older wounded warrior, the 18 plus to 22 plus collegiate athlete. These are going to be the people more predisposed to this, or the weekend warrior like myself, okay? So you have a big set of rings. They're like, if you cut down a tree, the rings of a tree, they're really hard fibrous tissue, and then you have a jelly center. It's basically 80% water and 20% goo is what I tell my patients, or cellular matrix. Throughout the day, we know from MRI studies that those discs are going to go from really fat and full, and they're going to shrink down by the end of the day. We know that happens just because we live on planet Earth. The interesting thing about a disc, again, just to remind you of when you're training your athletes, what positions to maybe avoid if they just rolled out of bed 20 minutes ago and showed up at practice, which most of us do probably, is axial rotation, which was this, combined with flexion, which is about every sport movement known to man, woman, or beast. Okay, why do you need to know this? Maybe you want it, maybe you don't, but in terms of a disc pathology, the only reason I bring this up is because if we can pay attention to what an athlete's telling us, which we'll cover here in a minute, if we can keep somebody in this first category of a disc, where you see how this one is kind of start to having a problem right there, you can see it's weakened and it started to lapse out. If we can keep them here, the likelihood that they're going to get better and never have pain again is substantially good. Like a matter of we can get rid of their pain within 2 weeks in the clinic and keep them healthy. You start getting over here, this is going to be in my 30s and my 40s, I'm already developing chronic back pain. I'm not going to be able to function. I'm going to miss work, kind of thing. So the other stabilities of the back. I always tell patients this because our very first thing with an athlete when we get to them on the field is what? We want to calm them down. We want them to know everything's going to be okay, regardless of if they're not okay right now, it's going to get better, right? So in the aftermath of an injury, when we see them back in the clinic in the athletic training room, or we see them in the clinic as a physical therapist, you're going to explain to this athlete that every joint in your body has ligamentous structure. They're not meant to be stretched. When you stretch them, They don't act kindly to you. They're not like a muscle with a whole bunch of blood supply. They don't heal quickly. So these ligamentous tissues are the same ligaments you have in your ankle. The only difference is when you sprain your ankle. Has anybody sprained an ankle before? What did you do? You probably got up, you're like, I'm all right. They limp around a little bit, and then you're back at it, probably. If you've ever sprained a ligament in your back, it's like, oh my God, it's a catastrophe. I can't get out of bed the next day. I've got the Oklahoma crick in my neck, or I can't turn my head, or I walk around like the old farmer like this for weeks. There's no difference in this ligamentous tissue than the ligamentous tissue in your neck or your ankle. It's the same thing. It's just more dramatic here. Okay? So you got lots of ligaments. Whether you want to learn all these, great. Whether you don't have to. The problem comes into when you have this young athlete who has an incidence of pain. If you go with the rub some dirt on it, quit whining, get back in the huddle, this is the sequelae. This is what's going to happen to this person. So you can start out with some kind of initial irritation of the ligament tissue, some irritation of a disc tissue, some rupture of a ligament, which we'll talk about in a minute, and it's going to lead you down this path of problems, which if you don't like to read, and you're like me, you like pictures, this is what's going to happen to their spine. So nice, happy, and healthy. We call these vertebral segments. So this is a vertebral body or a bone. This is a vertebral body or a bone. This is what we call a facet joint. So this little bony angle here and this bony angle here, they touch together and they articulate. They're their own specific joint. These are the most common cause of what we call mechanical back pain in the sports world. So I wake up and I can't turn very well. I'm stiff. These are the culprits. So this is healthy. You can see this disc has started to smush. This disc has got in the way of this little hole. So does anybody who's had anatomy or has not had anatomy understand the significance of this little hole? If you don't, this is where all the nerves come out that make your legs work. So if your athlete tells you my foot is numb and tingly, I can't lift my ankle up like this, I'm tripping when I'm trying to run, these are all warning signs that there's something in a space that there shouldn't be, and we got problems, okay? But you can obviously see the nastiness going down the track. So bone spurs, not good. So again, why do we bring this up to you? If you're going to coach youth sports or even collegiate sports, you're going to be on the front end of trying to prevent this from when they're older, okay? We don't think about that, but it's going to happen to us. So again, like I mentioned, the most common injury in the adolescent-based athlete is going to be what we call a spondylolisthesis. Big fancy word. All it means is that I broke my back. So if you look right here, this one's all nice and intact. This one's all nice and intact. They actually get a break through the bone right here. And it's usually from a forceful hyperextension, or those power lifters that have 1,000 pounds on their power clean or on their deadlift, and they do this forceful hyperextension and try and raise it up like that. It's going to cause an excessive shear force. The problem with this in the clinic and the problem with this in the athletic training room is that this person is going to present somebody just like somebody who had a muscle strain or somebody who had a ligament sprain. They're going to have this dull, achy pain in their back. They're going to be stiff. They're going to be uncomfortable. The only reason I decided to do this talk is because in my 13 years as an athletic trainer and physical therapist, it seems like every year in the clinic, I see more and more of these kids that are coming to see me who are missing their entire basketball season or football season because this got misdiagnosed as you just got a stiff back, okay? Am I trying to scare you and tell you that every one of your athletes who has back pain is going to have one of these? No, it's not an extremely high percentage. Again, these are just the two most common injuries. Or you've sprained or strained a muscle, or you've gone big. Okay, so just a reminder, this is the important scale. You need to know your athletes. That's the only reason I leave this up here. Occasionally I do moonlight athletic training is what I call it, where the athletic trainers here in Stillwater will call and say, hey, can you cover JV basketball, or can you cover JV football tonight? I'm like, sure. And so I show up and I have some kid whack their head against the floor, and I walk out there and they wouldn't have known how to count to 10 to begin with, and nobody tells me that, okay? So you have to know your athlete. So if your athlete has never been injured before and they're extremely dramatic about this ankle sprain, or this back pain, and they've never had any trauma like this before in their life, there may be some psychological overlay for these guys down here on this end. So the only reason I put this up here is to remind you, you need to know your athletes. You need to know what kind of person they are. Are they that tough, rub some dirt on it, or are they going to freak out if their toenail falls off? Okay? It's not to be confused with this scale, so the I'm hangry scale, okay? It's just to make sure you're awake and still paying attention. Everybody good? No jokes? Dang. Rough crowd. It even says bacon down on the end if you look really close. Tough crowd. All right, so quick review, just for a reminder. Does anybody know what the OSU score is, by the way? Somebody's got to be watching it right now.
10-6.
Okay, fair enough. Thank you. So, so just purely out of reminder, again, I'm not telling you that as a coach you have to be able to diagnose this, but if you can recognize these symptoms, you're going to be way better off and you're going to get your athletes back on the field faster by paying attention to this in terms of if you're going to have the not participate list every week of practice. So a grade 1 muscle strain basically means that they've irritated a little bit of the muscle tissue. I don't know if anybody can see my hands. We all remember the sliding monofilament theory, or however you want to say it, where the muscles are going to do this, right? At the microscopic level. So in essence, I've torn it a little bit, but it's not even torn enough that I can see through it. These people aren't going to have much bruising. They're going to feel like they've overworked a little bit. These people will typically get better if you can just let them actively rest, return to light stretching, and then slowly return them into activity based on symptom tolerance. Versus as we go down the list, we got bigger problems. So that muscle that we couldn't see through, now we got some light coming through there. We got some problems. That structural integrity is starting to change. Bruising, swelling, pain, irritation. They'll still be able to work that muscle, but it's not going to function the way they want it to function, and they're going to limit their ability to do what you want them to do or need them to do. Why do I bring this up in a lumbar spine lecture? The same muscle structure that you have in your lumbar spine is the same muscle structure function that you have in your knee and your ankle and everywhere else in your body. Obviously the fiber type will change a little, give or take, but you guys get the gist. Grade 3, obviously you know that this guy or girl is probably not going to come back to the sports arena quickly. This is minimum of 6 to 8 weeks, if not surgical repair and season ending, okay? And not to be confused with ligament sprain, but this is a different animal. This is a different type of tissue. If we don't protect this tissue and let it heal, this person is going to land down a path of instability, which means that joint is going to wobble all over the place for the rest of their life, and they're going to need surgical repair. So if we can fix this early on, it's going to help us later. Okay? So early on, grade 1 would be like most of you if you've ever rolled your ankle, whether it be drunk walking away from the bar and slip off the curb, or whether you were trying to score the game-winning touchdown and you fell on. The gist of this is again the same. So as we go down farther in the grades, grade 2, grade 3 are going to be the ones that are going to be frustrating to us as coaches. These people are not going to be able to participate. If they happen to participate at the grade 2 level, that side-to-side movement or even quick changes in direction are not going to go well for them. They're going to need to be braced if they even are allowed to play. Under a microscope, it takes 6 to 8 weeks for a ligament to heal. Okay, so again, why do I need some silly chart to remember? The only reason I leave this up here for anybody I ever talk to about a sports injury is this is going to help you tell, do I need to send them to the athletic training room or do they need to go somewhere else? Okay, like back to practice. So with the muscle, cramping, dull aching, we obviously have felt muscle pain sometime in our life. If anybody's broken a bone down here, the deep nagging pain, doesn't matter what I do, doesn't matter what I move, this is not going away. It's broke, right? And then obviously the ones that we don't want to see when it comes to the back are electrical pains, numbness, tingling, burning, loss of function of muscles to where they won't work regardless of how much I train them. These are the ones that are warning signs that you need to have something addressed as a coach, okay? These mean sinister pathology is what we call it for back pain. We don't want these. These are not good outcomes. All right. Again, basics. If you've had this in class, great. If you haven't, just for reminders, Every muscle in the body has some form of fashion of function. So when we talk about muscles, there's the agonist, or basically a primary mover. So for those of you who are like, where's the weight room at, and want to stand in front of the mirror and work your bicep curls, that's an agonist. The antagonist is going to oppose that movement, so that would be the tricep while you're working your biceps. And then the synergist, this is going to be the group that we're going to address the most in our core strengthening approach here in a minute, is basically the core has a ton of muscles that work in a synergistic fashion to stabilize your back, hips, pelvic girdle in general, okay? So if you wanted the muscles, if you like pictures versus words, the biggest thing to take away from here is that muscle function here is going to be basically big stability, big power muscle. These guys are really small, stabilizing muscles, kind of like the closest to the spine. And these are the one that gets the most clout in the literature for being able to train them specifically for our purposes. Whether I buy that, I don't know, but it's still there. So before we go any farther in terms of what we need to stretch or what we're going to do with our rest of our talk here, is the one muscle that I would want you to pay the most attention to is what we call the hip flexor group. Anybody ever tore their hip flexor muscle before or had a hip flexor strain? Doesn't feel good, does it? So we said at the very beginning of the talk, what are our athletes going to do all day long sitting in class and falling asleep in boring lectures like this? What are they going to do? They're going to flex. So these hip flexor muscles that come down and have action on my hip and make it do this, they're going to have the same reverse action on my low back because they attach all along my lower back here, and they're going to pull my back forward and cause this huge torsion force on my back and can lead me down a path of injury. So this muscle is a great muscle that we need to address and stretch and lengthen in order to prevent back pain, especially since we sit so long during the day as athletes. Okay, there's the other picture of the spinal stabilizers. Again, the only thing to take away from this is the most common one that you're going to see in literature is the multifidi. It spans 3 to 5 vertebral levels, so if it'll attach here, it's going to go down to here. Again, nothing great, but it's there. The big strap muscles that when you look at really tone athletes and they're really lean, the erector spinae group. Just to tell you how old I am, there used to be 3 of these. I don't know if you guys still learn this as 3, but their function is basically extension if you fire them all together, or side bending / rotation if you fire them separately. So they're just going to run basically from the base of your skull, just because the PhD anatomists meet 3 times or once every 3 years and decide to change the names of them from here to here. It's still the same muscle from the base of your skull all the way down to your butt. Okay? And again, huge function. Most of the time if you hear the term muscle strain, these guys are the first culprit that's involved. Thoracolumbar fascia, that's just fun to say. The thing to think about when we talk about the spine, when we start talking about core strengthening, this is a huge stability to the back. Okay, this is like having a back brace on whenever you're trying to do deadlifts or something like that. Whenever you tense up all of your core muscles, it's basically like the corset. If you've ever seen the older movies where women wear corset braces, it's the laces in the back. It pulls everything tense and tight. Again, your thoracolumbar fascia is going to be here. The interesting thing is you can cheat and train this in a bunch of different ways. I have a bunch of different exercises for you guys today that you can take with you. But your lats actually tie into the thoracolumbar fascia in addition to all these other tissues, even your glute muscles. And there's even a fascial connection, which is just another type of connective tissue from your hamstrings, which attach basically on your ischial tuberosity, the bone we sit on, and come all the way up and attach into that connective tissue as well. Here's a cross-sectional view of your core. So obviously we can see how everything's going to compress together and give stability to the back. Anteriorly, these are the ones that are the money makers, right? When guys and girls who are super lean athletes and they're just studs and you can see their 6-pack or 12-pack, these are the ones that we're going to see. The abdominals. Obviously, in most people's training, as I think back when I was writing this talk in high school, our football coach and baseball coach, we did leg lifts, we did sit-ups, and we did push-ups. That was our abs. That's what we did for abs. That's all the only exercises we did. So we focused in really well. Okay. The only thing to take away from here is if you happen to be training higher age range athletes, so possibly in the idea of pregnancy, in pregnant females after pregnancy, there's a little connective tissue line right here called your linea alba that holds your ab muscles together. So don't freak out if somebody starts to initiate their core and it looks like an alien popping out of their stomach, because this thing is separated and their intestines are poking into that visceral tissue here, and it's kind of coming up through this line. So there's really nothing they can do about that unless it's over about, I think it's 2 to 3 centimeters in width. So don't freak out. Just know that you need to figure out other ways to train their core without having them blow their stomach up. Okay. The funniest one in literature that used to drive me crazy in school is I had to spend like 6 weeks learning how to train this one tiny little sheet-like muscle. So when core strength training was initially come about in terms of buzzwords, we had to learn how to have somebody lay on their back with a blood pressure cuff underneath their spine, and they had to set the blood pressure cuff to 20 psi, and all they could do was pull their belly button in and up, and it could only go from 20 to 22 psi. That's how you train the transversus abdominis. To me, pardon my French, that's a load of crap. You're telling me that every athlete in the world needs to lay on a blood pressure cuff and they can only move at 2 psi, and that's going to train one muscle that's going to fix everything? So in the clinic, the thing that's brought me the most success that I'm going to share with you today, and the funny thing is it's pretty old school. It just makes more sense for our athletes. Again, a cross-sectional area, you can see how those muscles are going to kind of function together. And then the scary thought in terms of, are we doing what we need to be doing to our athletes to strengthen the core? This is just only a few set of muscles that are involved in the core. So if you've had anatomy or you haven't, most of these you can tell are either abdominal / hip / pelvis / spinal, even muscles that you would work if you want to look like you're the where's the weight room guy, right? Work my traps, look like a professional wrestler. All right, so I debated on whether to put this in. The only reason I put a review of the stretch reflex in is just in case you don't remember. Basically, figuring out how to override the muscle spindle is key in terms of stretching. So the theory is obviously when I was in school, everything had to be held for a minimum of 23 seconds to shut down the protective response of the muscle spindle and not overstimulate the Golgi tendon organ. I'm sure you guys are bored from physiology class. But for our purposes, all we need to know is that every muscle in the body has a basic protective response. So all I need is just enough stretch to make it want to relax. And the literature is even changing the data on how long that has to be. So depending on the muscle group, it can be as little as 15 seconds. And for other muscles, it can be as much as 60 seconds. But as long as you stay in that range, 2 to 3 sets, you're probably going to be effective in treating your athlete. So again, why do I put this up here? Because in youth athletes, in the literature, it tells us that the best 2 things you can do for youth athletic pain with low back pain is stretch the muscles that are tight and strengthen the muscles that are weak. So you need to be able to figure that out, and you need to know how to do it. Everybody good with that? Yes? No? Okay. So this is a pretty neat program. I think I'm doing okay on time. Yep. We use this in the clinic a lot. So if you guys want to check this out, I built this for you guys particularly. These are a set of common muscle stretches that I use in the clinic for somebody that comes in with back pain. So this code right up here at the top and this website right here is a link that will get you pictures and videos, and they're saved forever under that code and that link to show you every one of these exercises in action. And then I also have my email link to the bottom, so if you're like, hey, I don't remember that, or hey, do you got a stretch to work this? I'll post it to this code, again, because it's saved forever, and I can add more pictures and whatever else you need for this. Okay, it's a pretty neat interactive tool. We give these out to patients and athletes because it has a telltale marker. So if there's like, oh yeah, I looked at it last night, I can go online and find out that they didn't look at it last night. Whether we need that or not, no, because if I have my athlete come in, hey, do you remember that quad stretch I showed you? And they give me one of these. I think it was like this. You know, they didn't do it. Come on. We've all been somewhere as an athlete before and we forgot to do what we were supposed to. If you guys want to go over any of these or you have questions on any of these as we get to the end of the talk, please feel free. That's what I'm here for. Again, I'm here to try and give you the information you need to succeed here. So going forward, posture, we'll buzz through these pretty quickly. Why do we bring up posture? Again, we spend our whole day thinking about it, and this is how we're going to train it. So posture is provided by the ligamentous tissue, and it's also provided by the fact that I can do the cool party trick and try and balance a glass on its edge with nothing around it, right? So there's a passive zone where I can just stay straight up and down and not fall down. I can rely on the ligaments, which we don't want because it's going to cause pain. And then I have all of this muscle function of all these wonderful muscles here that are going to cause me to have stability. If we're coaches, what do you think the one thing that we can address in all this posture stuff is? That's a question. It's formulated in the form of a question. What can we address in all of these silly things? Can I fix somebody's ligaments as a coach? Can I fix somebody's ability to balance as a coach? Maybe. But I'm not going to change their equilibrium, probably to some extent. But I sure can get them into the gym and change this, right? The other funny one is basically how well the CNS works. So how well does my proprioception work, or my body's awareness in space work, okay? Which we definitely can train and we definitely can address as well. All related to muscle. So this is a slide I use in my PT program lectures. I put it in here on purpose because the only thing I want you to take away from this is posture can cause pain, and this is the one in your athletes that you're going to have to address the most. Hey coach, my back still hurts. I don't think I can practice today. Okay. Well, what makes it hurt? Whenever I sit like this, okay, it doesn't take a rocket scientist to know that, why don't we find you a way to sit up? Or why don't we write some kind of little note that says, hey, so-and-so can stand up in the back of the class so they don't fall asleep like that guy in the Nike shirt. Or so that it won't hurt my back, okay? So again, why does this matter? Why does this help us with athletes? It's everyday stuff. It's little things that we can change to get rid of pain, okay? Funny slide, purely you can see all the awful things that can happen. For your purposes, these are the things that we can stretch and address to make our athletes better. But the tech neck, everybody's looking at their phones all day long. You can't walk across OSU's campus without getting run over by somebody on a cell phone, right? This is just purely an attention getter, okay? So the slouched posture, this is going to put the most amount of torture or torque on your back. So just for review, because so many people spend so much time in front of technology these days, this is perfect posture in front of a computer, which nobody uses these dinosaur things anymore. So the problem that we have is everybody's got this little screen down here in their lap, their iPad or their mini laptop. So where's the first thing that's going to go? Your head's going to go forward. So just like you coach an athlete who's going to make a tackle or who's going to swing at something, and they've got their head down like this, where's the rest of their body going to go? It's going to go with them, right? There's no different in sitting. The only thing is we do this a whole lot more than we play sports. So we probably need to help our athletes do a better job of this if they have back pain. So they call it the rules of 90. So you're going to have a 90-degree angle at your back and your hip, 90-degree angle at your knee, roughly a 90-degree angle at your ankle, and a close to 75 to 90-degree angle at your elbow. If you're a taller athlete and you're like the rest of us in the world, chairs are built for people who are about 5'10". So if you're over that, your knees are in your chest. That's going to cause you more back pain. You need to have a taller chair. You need to scoot out in the chair, okay? This is not meant for you, okay? This is the posture that we want for those of you who have seen the Tommy Boy. You know, where's the weight room at? Tall, up straight, right? Just a reminder in terms of why we train the core. The only thing I want you to take away from this slide is if I lift a box that's only 20 pounds, which... does that look familiar for somebody who doesn't know how to deadlift or power clean? That's only 20 pounds. What do we take most of our athletes with? We usually at least have a 45-pound bar with a bumper plate on it, right? The most humbling experience of my life was coming from the strongest kid in the weight room in high school and going to college, and my strength and conditioning coach gave me a broomstick and stuck me in a corner until I learned how to do an overhead squat, as all my buddies were lifting heavy, right? So look at how much force is on your back right there. That's a 1-pound box in the same position. Look at how much force is on your back. Okay. Tell me we don't need to train our athletes to function a little bit better and be in the right position to prevent back pain, and I'll call you a liar. Okay. So this is old school. This is how I train all my athletes. You can see how updated my literature is right there, 1989. Most of you weren't even born then, right? Okay? So the idea here is if you only want to take away one thing is its progression. So it doesn't take a rocket scientist to know that I need muscles to make my spine function, and I need those muscles to do specific things, okay? So whenever I train my core, the thing that I'm going to think about is all about your pelvis. So before we go any farther, if you guys want to try this, just know that you're going to look ridiculous. I always tell my athletes the same thing. This looks ridiculous. If you want to do it behind closed door, that's fine. But you're going to always start with somebody laying on their back because that's when they have the most postural awareness. But all you're going to teach them is how to do what we call an anterior tilt. So they're going to rock their hips forward and arch their back or poke their big beer belly out. And then they're going to rock backwards and tuck their tail like a dog in trouble. So we call that an anterior tilt. It's going to cause a big, we call extension force to the back, shorten everything up on the back, lengthen everything in the front, and then we're going to roll backwards, which is what happens when we sit all day long. So we traditionally don't need to spend a ton of time there. But the funny correlation is when I have somebody on their back and I train their core muscles, this is harder. This is going to initiate all your ab muscles and make every core exercise you do feel awful, okay? But in essence, all I'm going to do is go from putting them into the position I might need to be in to make them facilitate that movement and then make it harder and harder and harder. So if you guys are personal trainers or you're already training people and you're already using core strengthening, think about some of the things that you do like, oh man, I could have changed this and didn't have to really do anything, okay? So what I mean by this is there's a really smart lady from the 70s that developed a program called PNF. Has anybody heard of PNF? Proprioceptive neuromuscular facilitation stretching, right? Or strengthening. She basically says that you can put the body in certain positions, passive free positioning, to cause the spine to do what I want it to do. So if I lay on my back with my knees bent, it's going to make my spine want to flex. Versus if I lay on my back with my legs straight and my arms straight, it's going to make my back want to extend. So if I have somebody that I'm trying to train and work their extension force really hard, I can have them in this position all day long, whether they're on their back or their stomach. It's going to be really, really easy for them to keep extension. But if I put them in this flexion-based position and try and make them work extension, it's going to make their exercises 10 times harder, okay? And then again, in the clinic or whenever I train athletes, until they can do this active control, which is what we just talked about, they're not going to this crazy lifting weights, doing plyos, doing crazy sled runs, pulls. Until they can do that and they have back pain, they don't need to go any farther. They're telling you that they're weak and they can't do what they need to function. You're going to lend them down a path of pain. They're going to hang on those ligaments and discs and tear things up. And then our ultimate goal for any athlete / patient is we want asymmetrical or asymptomatic exertion. So if I can get them back to a full training session and they have no recreation of their back pain, it's go time, right? We're ready to play. So again, just for the review of this is how the progression goes. You teach them how to do an anterior posterior tilt. If anybody wants me to show you how to do this after the lecture, I'd be happy to show you to train your athletes. And then I progress from there. And again, all I do to make things harder is I add movement to it. I add them moving a leg. I add them moving an arm. I add them holding a weight. I just change the position. This is an example of a healthy back class or a class that I would teach to athletes. I set this up in order of stations. I do everything for 1 minute and I walk around the entire time and I'm coaching every athlete. I'm going to make them tell me, what's your functional spine position? And they're going to be able to tell me, oh, it's when I rock backwards. It's when I rock forwards. And then the whole time that they're doing this exercise, get your back where it's supposed to be. Get to your happy place. Get to your functional spine position. And they're over there, oh, I don't want to do it. I can't do it anymore. It's too hard. I can't do it. So then you got to reduce the exercise. But again, these are not fancy out of the ordinary exercises. All I'm doing is adding the core component to it, and I can torture people just purely by adding the right tilt or the right position to their spine. Okay? So this is a pretty long list. What I tried to do is give you progression of every exercise that I would typically do in the clinic as a baseline, and then show you at least one exercise harder of all of them so that you'll have pictures and videos of these exercises as well. The code is at the top. You have access to it. But again, If I'm going to train somebody's core, what's the one thing, if you're going to take away anything that I tell you to do for training a core? They need to be able to find what? The position of comfort. So if they have pain, if you can get them to roll their pelvis either forward or backward and their pain goes away, you can train them all day long. Asymptomatic exertion. I can make them hurt. I can make them tired. They're two different things, right? I want fatigue without pain. Everybody good with that? OSU score? Anybody? No more points in the back?
I don't know now.
All right. So these sources are a little old. I didn't quite put every source in there. Obviously, most of them are linked into the pages before. And then for those of you interested, and I'm not trying to tout Stillwater Medical Center, that's obviously where I work, but my email address is there. I take questions all the time. Obviously, I teach, so I have students always emailing me questions. I don't mind them. But if you're interested in having to do some kind of internship for school purposes, this is the website at the bottom. And if you have trouble going through the website to navigate it, to find it, you can email me directly. I'm usually handling most of the student rotation stuff through where I work anyway. So if that can help you out in the future. I think we're okay on time.
Questions?
All these things are available on your website, right?
It'll be all in the PowerPoint, and I think
Okay.
Yeah, I'll send out the PowerPoint.
Dr.
All right,
Backhurst is going to share it. Yes.
I'm a rowing coach, and sometimes we have early morning practices, and the two things that you talked about being in that flexion position with the upper thorax and the rotation, we do both of those. Is there, or have you come across any research that helps prime the body to take on that kind of load better?
So the way I approach people who are primarily a flexion-based sport, which I would consider rowing a flexion-based sport, is I basically approach it more in the fashion of, I think I had this on the stretching one, maybe, way back here. But in essence, there's a really famous physiotherapist from New Zealand who had developed his whole institute of teaching the spine. It was purely by accident of having people like that. And so what they basically say is undo what you're doing to your body. So like I ride bicycles a lot. So about, I may ride 100 miles in a day. Every 10 or 15 miles, I'm up and out of the saddle doing something like this. So it's not possible to necessarily tell your athletes that you can stop in the middle of rowing and do this, but anything to basically teach them in sitting, like if they're on their rest or recovery or whatever, and they can cause lordosis in their back in that seated position versus letting them stay flexed over, it's going to be helpful. Or before practice, having them stretch into extension, like the yoga pose, a press up, or even resting on their elbows. And then after practice, different things to lengthen that out and put them back into that natural lordotic curve of your spine will be helpful.
So I notice in the gym that many people like to do the abs, but you don't see them doing the Superman very often.
Yes.
Right? And when we sit, we tend to hunch forward in that ab pose.
Mm-hmm.
Do you see that athletes tend to just have an imbalance between the front and back of their body just because of the way that they typically work out in the gym?
Yeah, I took that slide out actually. I had it in the PowerPoint. There's another famous guy, his last name is Yonda. It starts with a J, but he developed this idea of what we call an upper or lower cross syndrome. So wherever our Tommy boy was at, I don't remember which direction it was, but where's the weight room guy? Which is what we don't typically see. We call it the militant posture, or our big slouched guy. So this one right here, this guy would basically have developed everything back to help him stay here, and everything up here is weak and overstretched, which doesn't make a lot of sense because most guys who are like this have this big gnarly chest and they bench press 5,000 pounds. But in essence, we call it an upper or a lower cross syndrome. So you've trained so much of this and you've strengthened it and shortened it that you've overstretched everything on the other side and made it weak. But they call it an upper or lower cross.
I coach volleyball, and I've got a girl who's goofy-footed. Instead of when she chops the head, instead of hitting her left foot around in front, her right foot's in front. I've been noticing she has back problems And I'm wondering if that may be the cause.
Yeah, because I bet if you watch her, just because of that goofy-footed style, when she takes off, she's probably getting a big hyperextension force like this, and then when she lands, because she's taking off on the wrong foot, when she lands and comes down, she's probably landing with this huge extension that we call a combined movement force, and she's getting one side of her spines compressed really hard. Yep.
Any other questions? Okay, well, thank you, Jeromy, for joining us, and of course, as you said, if you have any questions for him, feel free to email him, and hope you make use of the access for all those exercises, which I think is invaluable.
Thank you. Thank you guys for having me.